can get started. First, I'll introduce myself. I'm Marcia Goldberg with the League of Women Voters, moderating tonight. And I also wanted to push two things before we get to our panel. And one is our Voters Guide website, vote411.org, where you can pull up who's on your ballot, what issues are on your ballot. In Shaker Heights, we have one issue on our ballot, and it's this one that we're talking about tonight. A week from tonight, Thursday, March 12th, right here in the same room, our mayor, David Weiss, is going to give his State of the City address. So you're all invited to that as well, and anyone watching this video is also invited. I'm going to introduce our three panelists. Will Tarter serves as an Associate of Public Policy and External Affairs for the Center for Community Solutions, a nonpartisan, nonprofit public policy think tank in downtown Cleveland. He works primarily in health and human services, examining demographic trends in seniors and young adults, as well as what public policy makers and community planners can do now to effectively prepare for the future. Part of that position includes serving as the staff liaison for the Council of Older Persons, an independent committee of 50 senior organizational leaders and advocates from across Greater Cleveland. Scott Osiecki, who's at the far end of the table, is the Chief Executive Officer for the Alcohol, Drug Addiction, and Mental Health Services Board of Cuyahoga County. He was appointed March 1st, 2018. He has been employed with the board in executive leadership capacities for nearly 26 years. Prior to being selected as the Chief Executive Officer, Scott served as Acting Chief Executive Officer and the Chief of External Affairs. David Merriman in the center is the Interim Director of Cuyahoga County's Department of Health and Human Services. He is managing the department's strategic initiatives and leading efforts to integrate human service and workforce efforts. He previously oversaw the county's Medicaid, TANF, which is what? Welfare. Child care, food assistance, and child support programs as the administrator. Thank you. Temporary assistance in need. And child support programs as the administrator of Cuyahoga Job and Family Services. I wonder, before you start your PowerPoint, we're going to start with Will's PowerPoint explaining this levy and the need for it. But I would like Will to just explain your relationship with the employees of the county and the county itself.
Sure. All right, thank you so much, and good evening, everyone. Will Tarter with the Center for Community Solutions. The Center for Community Solutions is a nonpartisan, nonprofit public policy think tank located in Playhouse Square. We've been around since 1913, and the focus of our agency is to be a research and analysis organization, and when necessary, an advocacy organization in health and human services at the state and the county level. Our job is to be a translator of sorts and to understand what is going on in the public policy arena at the county and the state level, and to translate that into digestible bits to share with the general public and with organizations that serve the community. Additionally, our job is to study what's going on the ground. So that's why the census is so very important, because we use that data to inform recommendations on public policy to county and state public officials. So we are an independent think tank, though we do provide services to the county in terms of analysis and study and recommendations, but we do try and take an independent take on issues of importance such as this one.
Thanks. Will is also frequently at the county council meetings where some of us observe. So that's how I got to know Will so well. Also at the Charter Commission.
And the NAACP too. So.
Yeah. Okay.
So multiple hats.
All right, Will, you go for it.
All right, so again, this is a really important issue, and one of the things that I want to do during my PowerPoint presentation is to bring everyone up to speed. Some people are very familiar with the Health and Human Services levy and the impact that it makes on our everyday lives, and other people are not familiar with this at all. And so what we want to do tonight is to bring everyone up to the same page and just kind of understand, number one, the choices that we have before us on March 17th, and just as important, how do we get here? And that's a really, really important conversation to have. And if you don't mind, I'm going to stand because it's just easier for me to present rather than talk from the seated position. So you may know that our primary is on St. Patrick's Day. And so when we're talking about turnout, it's going to be really, really important to make sure that people vote and they make their voices heard. And so, again, I've mentioned the Center for Community Solutions, and we recently streamlined our mission statement. So here's our unveiled Streamlined mission statement. We're a nonpartisan organization that really focuses on health and human services through research, analysis, communications, and advocacy. Now, what I'd like to kind of share with everyone is that Cuyahoga County has a lot of different funds and a lot of different ways of bringing in revenue. But for the sake of this conversation, we're going to focus on two funds. One is the Health and Human Services Levy Fund, and the other is the General Fund. So keep both of those funds in mind. The General Fund has been doing very well of late because, as you may know, sales taxes are up and revenue has been coming in, which is allowing a little bit more of a rosy picture of the General Fund. The Health and Human Service Levy Fund is comprised of two Health and Human Services levies, and I'll get to what those levies are in just a minute. Now, you may be asking yourself, well, why is Will talking about the General Fund? Well, the reason is twofold. Number one, the General Fund is the fiscal backstop to the Health and Human Services Levy Fund. So if the Health and Human Service Levy Fund levels get too low, the General Fund kicks in and makes sure that it stays afloat. But just as important in the General Fund is a decision that the county made about a year ago. You may remember back in 2007, the county commissioners passed a 0.25% sales tax to fund the convention center in downtown Cleveland. That was put into a separate fund called the 0.25% sales tax fund, and the revenues were very good, right, original, right? And so this sales tax fund was doing very well and had a lot of money in it. But what the county started to notice, and I'm just from an analysis standpoint, the general fund levels were getting pretty low. And so the sales tax fund was just kind of sitting there, and they thought, okay, let's put this into the general fund. So the general fund levels stay pretty rosy. And so when you look at that general fund, you'll notice that the levels are pretty healthy. But at the same time, we're also concerned about the pressures on the general fund because the county has several big decisions, things like the Justice Center and the Sherwin-Williams deal and whatnot, that will affect the health of that general fund. So we're keeping an eye on the general fund just as a whole. But for tonight, we're really going to focus on that Health and Human Services Levy Fund and those two Health and Human Service levies that contribute to its overall well-being. Those two Health and Human Service levy funds, Health and Human Service levies, one is an 8-year levy. It's a 4.8 mil levy that goes from 2007 until the end of 2024. And the smaller of the two levies, we'll call that the 3.9 mil levy, was renewed for 2 years back in 2018. That was for 2019 and for 2020, it expires at the end of this year. So what the county is proposing to do is to pass another 8-year levy. This one would go from 2020 until 2028, roughly. And so the theory is that the county would have two alternating 8-year levies. So every 4 years, the county voters would have a say on the Health and Human Services levy. But this is not just a 3.9 mil levy. This is a 4.7 mil levy. So there is an increase on top of the 3.9 mil levy. So we call this replacement plus an increase. Now, how many people know that you just went through your housing reappraisal process last year? All right. And so the county wanted to wait and see what those housing values were going to be, which is why they didn't make this decision back in 2018. They wanted to see what were those new housing values going to be so they can calculate how much revenue would come in and figure out what they would go to the voters for in 2020. And that's exactly what happened. And so together right now, those two Health and Human Service levy funds bring in about $244 million per year. And if this increase were to pass, it would bring in an additional $35 million per year. Homeowners would pay an additional $41 per $100,000 valuation. And combined, these two Health and Human Service levies would cost about $296 per $100,000 valuation. So now that we know how much money comes in and how much it costs individual taxpayers, let's talk about where the money goes. The lion's share of these dollars go towards job and family services. Many of the programs that we know are funded through JFS or Child and Family Services. But many people don't know is that the Alcohol, Drug, and Addiction Mental Services Board also receives about $39 million, now $40 million this year from the Health and Human Services levy. Metro Health also receives $32 million per year. Juvenile Court receives money, the Department of Senior Adult Services, and I'll get to this in just a minute, but 90% of the Department of Senior Adult Services comes from Health and Human Service levy dollars. 100% of the Office of Reentry comes from Health and Human Service levy dollars. Homeless Services, $6 million goes from the Health and Human Service levy fund. And many times, as David will attest, these county dollars are used as a match for drawing down state and federal funds. So these funds play a large role, frankly, compared to other counties in the state of Ohio in our ability to provide health and human services to the community. Now, we look at the Health and Human Service Levy Fund, and we look at the general fund, and we look at its overall health. Now, the Health and Human Service Levy Fund, according to a recently released report by the county, showed a deficit of $7.4 million at the end of 2019. Now, remember how I said how the Health and Human Service Levy Fund is backstopped by the general fund? So the county decided to take $15 million from this general fund and put it into the Health and Human Service Levy Fund to keep that fund afloat. The deficits from the spending of the Health and Human Service Levy compared to the revenue that comes in, those deficits are going to continue to grow year by year. One estimate by the county says that that deficit could grow to $33 million and then eventually grow up to $105 million by 2022. And so the county is looking at the long-term forecast and saying, look, we're aging, we have a lot of kids in foster care, there's a huge need that's going to grow in the next few years if we don't do something to bring in revenue to help us meet the needs in our community. And so that's why this levy is so important, because the county is looking at the long-term health of health and human services and the ability to meet the needs that are in the community, and they recognize that something needs to be done in order to help shore up that fund. Now, we look at foster care as one of the contributing factors. There are almost 3,000 children right now in foster care. The in-county foster care system right now is full, and over 30% of children who are in foster care are placed out of county because they're not placed in the county. 13 children are placed outside of the state of Ohio. So when we look at the needs of the children in foster care, due in large part to the opioid epidemic, it's providing a huge drain on the county's resources. Additionally, we're an aging county, and we recognize that of the 11 county council districts, 2 of those county council districts already have more individuals over the age of 60 than young people under the age of 20. This trend is going to continue to grow, and by 2030, that will eventually be the entire county. So what can we do today to prepare for an aging wave that we know is coming? What can we do to maintain a high quality of life, not just for baby boomers who are in their 60s, but also as they take care of their parents who might be in their 80s or 90s? So we need to really think about what our needs for serving seniors now, what our needs going to be in the future, and how can we financially prepare for that reality. Now let's clarify a few misconceptions. A lot of people look at the funds that come in, like the opioid settlement dollars, and they say, look, the county's getting $116 million. Isn't that going to help offset some of those balances that we were talking about, those deficits? And the answer to that question is no. Here's the reason why. Those dollars are one-time dollars. Once you spend them, that's it. The deficits that we're talking about now are only going to grow year by year. Additionally, those dollars are targeted in where they can go because it was meant to be a settlement for the opioid addiction. And so some of those dollars can be used for drug addiction, not necessarily for mental health, as Scott can attest. And so we need to think about how these county health and human service levy dollars are extremely versatile in where they can go, unlike the opioid settlement dollars. Now, in the last state budget last year, there was a slight increase in health and human services spending, which all credit to Governor DeWine and the General Assembly for recognizing that there was a lot of health and human services needs out there. But like peanut butter, that increase was spread throughout the state. And therefore, it's not necessarily going to be enough in Cuyahoga County to help offset those deficits that I mentioned earlier. So while it's helpful, it certainly does not delay inevitable fiscal reality that the county faces. Now, a lot of people will say, well, $35 million per year that comes in, why can't the county tell us where these dollars are going to go? And here's the reason why. So last year, the county went through their county budgeting process, and there's an agreement between county council and the executive on what the budget looks like for 2021 and 2022. If this levy were to pass, those dollars, I'm sorry, I misspoke. The budget is for 2020 and for 2021, so I apologize about that, 2020 and 2021. If this levy increase passes in March, the dollars would start to come in 2021. Now, I said I would bring in an additional $35 million in 2021. But when the county was doing its budget last year, they couldn't prepare for a budget increase. They couldn't plan for a levy increase because they didn't know if it would pass. So they only passed the budget at a certain amount of about $10 million more, not the $35 million more. And so the county executive and the county council would have to agree how these dollars would be spent in 2021. And right now, there's no agreement on how those increased dollars would be spent. So what the county executive can do is suggest what he believes these dollars would go towards. But how they're actually allocated would have to be decided between the county executive and county council. So it's a question of timing. It's not trying to mislead anybody. It's a question of timing. All right. So in closing, the election day is less than 2 weeks away. And one of the things that's really important is to understand where we are currently in the fiscal realities that the county faces, how we got here, and so that we can collectively talk about the best way forward. And the Health and Service Levy issue is issue 33. And so if you have any additional questions, I'll be happy to answer them during the Q&A, but I'll also hang out after the event as well. So I hope that's helpful, and thanks for the opportunity to share that with you.
Thanks a lot, Lou. I just have one quick question. What is the relationship between the county and the state? Like the county dollars and the state dollars? Mm-hmm. You mentioned something about that. You want to?
David, I think, might want to chime in.
First, good evening. Thank you very much for including me tonight. Again, my name is David Merriman. I serve as the Interim Director of Health and Human Services, but I am here on my own time and would be happy to try to explain how the county, the state, and federal funds come together. I think the first thing to recognize is Cuyahoga County and all of the counties in Ohio are part of a government structure where the federal government grants dollars to the state, and then the state grants those dollars to the counties. This is referred to as a state-supervised, locally administered structure. We're one of, I think, about 10, maybe 11 states in the country that have this structure. So the dollars that come to Ohio, say for Medicaid, are then appropriated to each county. The state keeps some for their administrative purposes, but then also divvies up the resources and tells the counties, this is how much money you have. And in that, counties have the option. We can add to the resources that come from the feds and the state with our own dollars. And so in that, we create a levy and are able to, one, match the dollars that are coming to us from the state and, when possible, provide services beyond those federal dollars. So from our perspective, the levy dollars enable us to leverage federal and exceed at times the standards set forward with federal dollars. We may provide a higher quality of service than a neighboring county or another county. We may prioritize one area or service or need different from another county. And at the end of the day, we work very closely with the state and the federal government. That makes it complicated because the rules of the federal government may be different at the state level, and we may actually apply rules on top of that. And so just as we make decisions about how to use the funds, we also have to track what are the expectations from the state and the federal government. It's a complicated answer. It is a complicated structure, and at times it makes it very difficult for us to compare Cuyahoga County with other communities. You know, for example, at times it can be difficult to look at how we would compare with Indiana, a neighbor, because they have a state-administered system. And but we do have the capacity to do some performance benchmarking. Our Office of Innovation has a wonderful 60-page report about how the county is doing with its funds. and what sorts of outcomes it achieves, and when possible, what are peer cities' outcomes, to show what funds achieve what purposes.
And can you tell us roughly, does the state add money to the federal money?
So federal money requires a match, and the state frequently meets that match. And so, yes, there are requirements with the federal funds that come to us, and then the state also requires at the local level for us to contribute.
Okay.
So yes, the state does contribute their own funds, and then we contribute funds for the service.
Can you give us any idea about how much you get from outside sources other than our own levies?
I would have a hard time answering that because it's a case-by-case basis.
Yeah, I'm sure.
My understanding is Ohio has historically been one of the states that rely most on federal funds. It contributes amongst the least of all of the states in the country to human services.
Oh, interesting. We did have a question about the opioid settlement. Does it not help, Scott, your organization, your division or department any more than any other? Will it? Or do you not know? Do we know
No.
anything yet?
No, we do. Okay, so Dave and I have been working on this as well with the opiate settlement. So the first round settlement was done and they received the money was $23 million. The ADAMHS board, we are receiving $10.5 million of that dollars. What we're doing with that is we are increasing our residential treatment beds for opiates with Stella Maris. We're adding 32 beds, 16 for men, 16 for women. We are at St. Vincent Charity Hospital, we are increasing their intensive outpatient treatment as well as their partial hospitalization program. And they're also expanding their ability to intake 24 hours a day, which they don't currently have now. And at Stella Maris, we're also increasing the intensive outpatient and the partial hospitalization program. And then there's something that's a sort of an innovative program, is peer support. So it's a peer recovery coach. So it's a person with lived experience who lived through an opiate addiction and they're living in recovery. So right now they're operating in Metro Health and St. Vincent, and we received a grant for that. We gave them a grant for that. And the peers are available in the emergency rooms 24 hours a day. And what they do is when a person is revived from an opiate overdose, the peer directly goes to their bedside and talks to them and lets them know that recovery is possible, and they'll be able to help them and walk them through the system of how they can get help. They could even drive them to a detox center or other place, the residential treatment with that. So we're looking forward to that. We're expanding it in Cleveland clinics, ERs, and university hospitals, a total of 10 ERs throughout the county. So if it makes a difference, right? So hopefully it will, because we're adding additional treatment beds. And the ADAMHS board, we also, with our money that we receive, that is something called sober housing. So when a person, they detox and they go to residential treatment, and we're adding the beds because oftentimes there aren't treatment beds available. So, but after the treatment beds, they need to go someplace, maybe not back to their original home where they lived, because that's where they got into trouble with the opiates, with the drugs. It's not a good environment for them. So they need to live in a sober housing for a while. And there's different levels of sober housing, and we pay for those. Some are just a safe, sober place to live. Others offer, AA and Narcotics Anonymous meetings. And then other ones also offer some additional treatment in those homes, as well as transportation back and forth to the treatment programs, the IOP and PHP. So we're estimating that the peer support group would be able to serve an additional 3,000 people per year. Stella Maris, I believe it was 325 additional people per year there, and I think it was 250 and another 2,000 people through the peer services expanding.
So you are involved in
Oh, mhm.
making decisions about where
Yes.
this money goes?
Yes,
Okay.
yes.
We've had a question kind of related about United Way funding. Do you get United Way funding, and are the cuts to that going to be impacting your board and
We
department?
actually provide funding to United Way to operate 211. So for information and referral services for people if they have a question about alcohol, drugs, or mental health. Another thing that the board with, I want to
No, wait a
mention.
minute, just explain this. I mean,
okay.
United Way.
Yeah, United Way.
Just the relationship between
So we
Health and
fund
Human Services and United Way. So
Right,
you
so-
fund
right.
United Way Services
for 211. For 211. Now,
Okay.
United Way, they fund some of our provider agencies, but nowhere near the capacity that they used to be able to do that. But something I want to mention about 211, but it's issue 33, Health and Human Services pays for our 24-hour mental health and addiction crisis line number, and we also have mobile crisis teams as well, and that's 216-623-6888, and that's really important to let everybody know, because that's a service available to anybody in the county free of charge. And we also offer mobile crisis teams, and the additional $1 million that we got this year with the levy, 600,000 of that is going towards expanding that service to offer more mobile crisis teams. Yes, that's what I wanted to mention, I'm sorry.
Could we, I just want to also mention that the Board of Developmental Disabilities has its own levy that voters recently faced, right, Will? When,
It was several years ago.
was it?
Yeah, it was several years ago, but that levy is in perpetuity, which
So
was
it's
under the-
continuing.
Correct.
We will,
We
it'll
don't-
get the
it's not
money
subject to a
in
vote.
that we originally voted
Correct.
for.
It was approved under the commissioners, actually. So
The commissioners, oh,
Yeah, so-
wow.
yeah.
That's a while ago, huh?
So yeah, it's at least 10 years. And so, but the revenue that's been coming in developmental disabilities will tell you this is has been steadily decreasing, and so they're concerned about the long-term health of developmental disabilities funding as well. But that is separate from the Health and Human Services levy conversation here.
Right, I want to be sure people understood that.
Your question about the United Way, though, I think has kind of brought into focus the relationship between funding sources and organizations that serve the community. And that's one of the things that the Health and Human Services levy provides, the ability for many of these organizations to provide services on the front lines, frankly, of a lot of these major issues. And I think, unfortunately, not to say it unfortunately, but there's a lot of people who are doing great work on the front lines of these organizations, and they might not even be familiar with some of the structural policy changes that are taking place either in downtown or in Columbus that would fundamentally affect their ability to provide services to the community.
Oh, can you explain that?
Oh, sure. So you have so changes like in the SNAP program right now. There's a federal rule that's being
Just to
proposed.
explain what SNAP
Oh,
is.
SNAP, Supplemental Nutrition Assistance
food
Programs.
stamps.
Food stamps. Okay. Sorry, I was trying to pass my my pop quiz on acronyms, but I failed. So food stamps. So there is a change right now that's being considered at the federal level, which would drastically reduce the number of individuals eligible to receive food stamps. And it would impact the city of Cleveland in a very powerful way, and frankly, communities across the state, both urban and rural. And so the change at the federal level, many people didn't even know how big this change would be until analysis was done by think tanks and other organizations that said, here is the effect that it's going to have on communities and the number of people that's going to be affected. And unfortunately, a lot of things will take place and people will learn about it after the fact. And they will only realize what happened until it affects them on a very tangible and everyday basis. And so what we try and do is we try and get out ahead of those decisions, where we let people know, here is something that is being decided right now, where there's public comment that's needed right now.
On the federal level.
On the federal level, on the state level, and at the county level sometimes, where if we can try and inform people and bring them up to speed on a decision that's being considered, things like the Health and Human Services levy, then when a decision is made, then people better understand not just what happened, but why it happened. And I think that's something that, as advocates, we have a responsibility to try and get that information out to our networks so that people understand when the United Way story happens, that they understand kind of what the rationale was behind that, but also what impact does that have on other sources of funding, like the Health and Human Services levy,
Right.
which in some cases organizations will start to lean on more and more to try and meet their needs.
Can I speak to that?
Yes, yes.
So there was
please.
also a question about how we use federal funds and the amount of funds and how funds come together with local dollars. Probably didn't do a great job answering it, but this is a great example. So the SNAP program, Supplemental Nutrition Assistance Program, that Will referenced, it has that requirement, stipulates that a resident receiving SNAP has to do certain activities to be able to continue to get benefits. And there are probably around 4,000 residents in Cuyahoga County, between 4,000 and 5,000 residents that are getting SNAP that have to do something. And the federal government provides us $900,000 to serve that 4,000 or 5,000 residents. And by comparison, the federal government provides us around $20 million to serve 1,000 residents that are getting cash assistance. So we get $900,000 to serve 5,000, or we get $20 million to serve around 1,000. You wouldn't be surprised to know that the quality of service that we offer for the 900,000 is greatly insignificant and inadequate to meet the needs. So, but this is why the levy is important. The federal government does provide an option. If you use your own local dollars to address that same requirement, you can bill the federal government and receive a 50% reimbursement. This is called SNAP 50/50 reimbursement. Really exciting. And we, Cuyahoga County, were the first county in the state to replicate this model locally. And in our first full year, we were able to draw $800,000 in new reimbursement back to the county. And so why is this important? First off, it's meeting the needs that Will described to help residents stay on SNAP. This isn't big money. This is $192 a month. But if you are not working, imagine not having $192 a month. Here's where this connects to United Way. The agencies that are able to draw this reimbursement have to use local dollars like United Way. And we know some of them use United Way dollars. Those local dollars can't be leveraging any other federal reimbursement. We call that clean. They're clean dollars. So Cuyahoga County has now implemented a workforce program. It's a national best practice, leveraging local dollars, including United Way dollars, to bring in additional reimbursement to grow our programs that will do two things. First off, it will help people stay on SNAP. And secondly, it'll actually give them exposure to good training programs, help them build skills, and connect to workforce. We recently had the Federal Director of Food and Nutrition Service in to look at our programs. We took her to an organization called Newbridge, and she toured the organization and saw about half of the class was currently working in healthcare, and they were on SNAP, and they were trying to better themselves. And this is important because Will and I and Scott, we can talk about the mechanics. We're talking about residents. We're talking about our neighbors. They live in our community, and they're trying to better themselves. And these federal dollars are insufficient. And so we have to leverage our local resources. And we have to meet them where they are. And we do that. We can leverage United Way dollars. We can draw new federal dollars to grow our programs.
And it's
so that
all
we,
used for the same
That's right, and it
program.
goes back in, and when we get the new reimbursement, that too can be reimbursed. And in that way, we can grow our systems, and that's exactly what we're doing. And at this point, Cuyahoga County is the primary county in Ohio that's doing this. And we think there is a model here that lets us replicate into new areas. We've recently expanded that program to include 2 programs that serve homeless individuals, or focus on homeless individuals, and 1 program that focuses on individuals coming from Hispanic countries. We feel like there is an unlimited resource here, nearly. And this is how what happens with the levy relates to what happens with United Way, relates to what's happened with federal funds.
Okay. Thank you very much. Sure. Oh. For many years, I worked at a local neighborhood center. And this whole issue of matching money was pretty critical because we were able to use county money
as a match to draw down state money to run our senior program. So this is home-delivered meals, transportation, et cetera. And the county, using the levy dollars, came to the rescue of a lot of senior centers in the community when we got cut from the state, because the state got cut from the feds. So, I mean, it's pretty critical. And, we can point directly to levy money to save hundreds and hundreds of programs in this community that required the match.
And even with the importance of it, the ADAMHS board, we received 40 million from the levy. Our whole budget is 60 million. So the rest of it comes from federal grants that we get, state grants that we get. So it's vital to the operation of providing mental health services and addiction services to the people of Cuyahoga County.
Can you just explain how these grants, how do you get the grants? Do you have to apply like?
Yes, we apply.
Yeah,
So,
okay.
so the federal government.
But you're told, hey, this grant is out there, and yeah.
We have a grant writer who searches for available grants. Like the federal money, state opiate response grant went to the state, and then we had to apply, make an application to receive that money for Cuyahoga County. Then we also get grants from SAMHSA as well, Substance Abuse and Mental Health Services Administration. But the grants are very small compared to
The levy
the
money.
people of Cuyahoga County.
Can I also respond? And the grants, that is one way you get competitive grants, but you can also get grants that are public assistance related that are not competitive. For example, TANF, the Temporary Aid to Needy Family Program, those dollars go to the state as a block grant, and then the state gives them to the county. And so
Without your having to apply.
well, you put in a plan every year, and
I
you
know, so
expect
it's
to
a
get a certain
routine.
amount to
Okay.
manage programs, but you get a certain amount to manage programs every year, and every year we overexpend our grant. Now, why would we do that? We would do that with levy dollars because we know others will underspend their grant. And at the end of the year, the state will come to us and they'll say, so who has dollars that you have not used? We're going to collect those back in. Who has overspent their dollars, we'll redistribute to you. So every year, we overspend our grants because we have levy dollars available that enable us to draw additional unallocated dollars from other communities, bringing in additional state and federal dollars. And we can't do that without the levy, because that's how we can maintain our fiscal stability and leverage new resources.
Can you also talk about Medicaid funding from the state? I mean, you're smiling. I mean,
Yeah, yes. I will, let me be
the
brief on
Medicaid
this.
expansion
Yes.
that Governor Kasich insisted on doing.
Yes.
And
Yeah.
it's continuing, right?
It is. It is.
So just explain how that money comes to the county.
So Ohio chose to do Medicaid expansion, and I understand there are times that we fall into either partisan alignments, and this is a nonpartisan event. I want to just acknowledge that John Kasich did something brave, and I'm grateful for him and the state for accepting this opportunity and bringing Medicaid expansion to Ohio. There are catches, right? And so this is an area where, so we do now have Medicaid expansion that we're able to offer Medicaid to individuals and families that are working that would otherwise not be eligible because they're not an aged, blind, or disabled individual, or they're not a child or a pregnant woman. They can still get Medicaid because of state commitments. Now, what the levy is doing is the levy helps us administer that program. So as we talked about with match, when you get your resources from the state, that includes, when you get your grant from the state, that includes federal Medicaid dollars and some state dollars as well. But generally speaking, the counties also have to make some contributions. And we are able to use the levy to make those contributions. And so at times we have to do overtime. Let's say there's a large backlog program requirements. We will use levy dollars as a means to pay for the overtime, knowing that we'll get some reimbursement back from the feds. So it won't be as big a hit to our budget as would otherwise be the case. It is complicated. I'm going to go ahead and recognize that. and we would need much more time to talk about it.
Scott, did you want to say something?
Yes, so on the ADAMHS board part, so Medicaid, it expanded to pay for treatment services, but still not everybody is eligible. Plus, there's a time when you apply until you get approved for it, that the ADAMHS board will cover those costs of that treatment
How
services.
long does that take?
It could take 3 months to a year sometimes, right? It all depends. Is that true,
It could
Dave?
be 30 days.
Yeah,
Okay.
it depends if you,
It depends on the circumstance.
Okay.
and how you hit, and if they have to get more information back and forth from doctors and things like that. But I want to point out is, though, it doesn't pay for a lot of services for recovery, right? It doesn't pay for those sober housing, right? It doesn't pay for a lot of crisis services that are available to people. It doesn't pay for a lot of our education and training programs that we have. So so that's why the expansion was good, but then also when it did that, though, it also brought more people into the system that didn't think about it before, which added more recovery services need to be added in there as well. So without the levy, we wouldn't be able to have all of the recovery support services that we have.
Will, I have a question that just came up that I don't recall you're mentioning this in the PowerPoint, but is there levy funding for the juvenile court? Did you say something about that? How does that relate to HHS?
Yes, there is money that goes to juvenile court. No, those are county dollars, but there are other sources that go into the court system, but juvenile court is one of them. I think I mentioned it in the
Well,
list
you
here.
definitely did.
Yes,
I
yes.
see
But that's
the
okay.
list.
So
Okay.
so it's on there. There are a litany of places that these health and human service levy dollars go. But one of the things I think for me, and we did do, by the way, a paper that explains where all of these health and human service levy dollars go and the amount of where they go to.
So how would a person get that?
I go to communitysolutions.com. Thank you. Go to communitysolutions.com, click on resources, and you can search health and human services, health and human service levy, and my breakdown of the 2 health and human service levies comes up. We also did a levy schedule. So one of the things that we found is that a lot of voters would go into the polling location and they would see an issue on the ballot and they would read it, and then they'd have to decide yes or no right then and
Right
there.
there and then, like people at the primaries when they were in line and they weren't sure who they were
What
going
to
to
do.
vote for?
And I heard that from a number of people. And so one of the things that I decided to do was to examine the county levies when they come up on, for a vote, where the dollars go, how much does it cost an individual homeowner. So this is both health and human services levies. Tri-C has 3 levies. They have 2 operating levies and 1 capital levy. The Port Authority, Metro Parks, Arts and Culture, Public Library, which is in perpetuity. But one of the things that I think people would love to learn is not just how much does it cost them, but where are our dollars going? And we're a very generous community, and I think we all up here can recognize that. And we all need to be sure that we are aware of how our dollars are being spent and the impact that these dollars are having. We love our Metro Park system. And so things like that are an example of taxpayers saying, hey, we value our metro parks and we want to support them through our taxes. And so that levy schedule is available on communitysolutions.com. And I invite you to just go to Community Solutions, type in levy schedule, and the article will come up. But one of the things that I want to kind of just point out is that these health and human service levy dollars affect people across Cuyahoga County. The exurbs, the inner ring suburbs, the urban areas, lest anyone think it's those people over there. It is everywhere that health and human services are needed. We look at the 211 numbers and zip codes where people need help with prescription drug cost. We look at seniors who have limited amounts of income, and so they are trying to make decisions on their spending. And that's where senior services can step in and help people, again, across the county. We look at the opioid issue. This is something that affected people across the county. Drug addiction in general, not just opioids, but drug addiction in general affects people across the county. So there's a lot of health and human services needs across Cuyahoga County, and I think it's important, no matter where you live, to recognize that these are your neighbors, these are your coworkers, these are your colleagues, and make sure that we're aware that these health and human services levy dollars affect us, whether directly or indirectly, and that's something I really want to underscore.
Specifically, the juvenile court, that money would be for treatment of juveniles in the court system or in the justice center, or what?
I'm not exactly sure the exact spending.
But it would be health and human services.
It would be
needs.
health and services related, correct. And that's something too that there are things that, like the Office of Reentry or Juvenile Court, that affect health and human service outcomes, right? So we may not necessarily
Absolutely.
think of them as
Yeah.
health and human services, but they no doubt affect health and human services. Things like Step Up to Quality, the education program, is partially funded by health and human service levy dollars. That provides tuition for students who are going from high school into college. So we think about this in terms of the versatility and the flexibility of these health and human service levy dollars. They go into a number of very important subjects, not just what we traditionally think of health and services.
Thanks.
I just want to point out that all of the organizations are all partners. We all work together to make sure that we're getting the best services that we possibly can.
Kudos to the county for that, because the county has to get creative on things like, we talk about foster care and then children who need, who have disabilities or have some sort of special needs. And the county has a relationship with the Board of Development of Disabilities that allows for them to draw down dollars that helps carry the burden, the fiscal burden, of providing services to children with needs that would otherwise be paid 100% with county health and human service levy dollars. So sometimes these collaborations are very helpful in helping to draw in outside resources to help with health and human services needs. So there's a tremendous amount of credit to the county for thinking about how these organizations can work together to draw down additional funds.
So David, I wanted to get a better picture of Cuyahoga County. We've had a question about our aging population, the poverty level in our county compared to other counties in the state, and the demographics here. Can you talk about that a little bit? I mean, are we the oldest county in the state and the poorest? Or I've read a statistic that we're actually the 13th poorest county in the state, but you're talking apples and oranges sometimes. The counties are so different.
Right, yeah, I don't know that I could answer the question, are we the poorest or where we stand on those variables? Let's just recognize any level of poverty, especially among seniors, is an issue that we should be addressing. We know that there are some, rural communities that have a higher level of poverty than us. I don't think we should compare ourselves to them because conditions are very different. At the same time, there are residents living in this community that are living within a stone's throw of great wealth, and yet at the same time they are living in poverty, and we have to be responsive to their needs. Until very recently, Ohio was one of the worst funders of senior services. Talking in the last 10 years, we would get $14,000 a year for all of our senior services from the state. $14,000 a year. Everything else, all of the other funding came through the human service levy or shifting dollars between programs where we had some discretion. Right. And so the senior service system that we have in Cuyahoga County it's a near best in class system. And it largely exists because of the health and human service levy. And it doesn't meet the full needs of seniors. There are major issues with seniors and food insecurity, within housing and independence, with social isolation. We're seeing there's some great concern around abuse of seniors, especially financial crimes. And so the needs, unfortunately, are growing, and much of that has to do with poverty. It also has to do with isolation. Mm-hmm. And our human service levy responds to that. Our Department of Senior and Adult Services is just down the road on Kinsman. And we are in the community because we understand that our seniors have needs that we have to be responsive to. And so to answer your question, I can't speak as I said. Well, I'll let Will do it.
Yeah, sorry, I'm on the advisory
can
council for the Department of Senior Adult Services, so I can chime in a little bit, but they did a great job. But just to provide some numbers from the state, the state provides about $48,000 per county in adult protective services. $48,000 per county across 88
For any
counties.
size county.
For any size county. They spread it evenly among all 88. And so you think about instances of exploitation of older adults, whether it's physical or financial or mental abuse of older adults, and that's not even one salary, one full-time salary. By comparison, Cuyahoga County, because of these Health and Human Service levy dollars, we have $3 million of the Department of Senior Adult Services budget goes towards adult protective services. There's 23 investigators that can investigate instances of senior abuse because of these Health and Human Service levy dollars. Now, the state did, to their credit, increase the amount of money that goes towards adult protective services across the state. It is an uphill battle, but again, these Health and Human Service levy dollars can step in and can supplement in a mighty way the dollars that come in from the state. Can we also recognize Councilwoman Chantel Brown, who
I was
is
just going to say
joining
that.
us? Yeah, so-
Chantel walked in.
Councilwoman Brown. Hi.
She voted.
Sorry.
She voted to put this on the ballot.
Absolutely,
9 out of the
absolutely.
11 council members did that.
Absolutely, I don't want to be.
Can I just say one more thing about senior services and the network of providers and relationships that we have as a result of this levy? So Will talked about what is probably one of the most difficult elements of senior services, adult protective services and investigations. But I think we should always recognize that we also have wonderful partners. We partner with municipalities to do congregate meals or community meals. We partner with nonprofits to do home visits and assessments. And I do think there's a bit of a risk when you focus on those critical elements that are essential but are also the most trauma focused, which is you don't talk about seniors as an asset to the community and the role they play by staying in their homes for the community's welfare. And I think the Health and Human Service levy allows us to support seniors to stay in their own home and then to keep a home occupied on a street that supports a community. And that is essential. Communities need residents that are making lifelong investments. The Human Service levy allows us to do that.
Absolutely. Oh, gee, I lost my train of thought there. I was going to go back. You were just talking about. Seniors? Yeah, seniors. Oh, well, yeah, absolutely. God, it was right on the tip of my tongue. Oh, well. Oh, I know. The number of employees in the Health and Human Services department, or what do you call it? Is it a department or?
It's the Department of Health and Human Services.
Okay, so the number of employees versus actually with your partners across the county, how many people are involved in doing these services? Quite a bit more people than are employed by the county, although the other agencies get funds.
Yeah, so
Or-
over 2,000 employees in the Department of Health and Human Services spread out across our 8 divisions. But if you think about the amount of funding that goes to our partners at the ADAMHS board, our partners at Metro Health Hospital, I mean, you're talking tens of thousands of employees that are funded partially or fully with human service levy dollars. And I want to also say that doesn't fully capture it, because then there are many volunteers in this community that are also working with our participants, and they may not get paid, but we're funding an organization that is providing a place for a congregate meal for seniors to come
So
on
there
a
are
daily
volunteers
basis.
involved
They're
as well.
volunteers. And, and our funding may help pay for the food that's being provided, but, the sweat equity that we get as a result of that opportunity is actually much greater.
Okay. The Fiscal Office, and how do you guys work with the money? I mean, 2 of the members of council were concerned about how the money's spent, how large the increase would be, and the lack one of them said a lack of planning on how this would be spent. Now, I think Will explained why we can't know for sure how this will work out with how the money will be spent. But could you talk about how the money is handled in the county and how you work with the fiscal office?
Sure. I can talk on a couple of things that can add to what my PowerPoint explained earlier. So the county, when they were deciding whether to go for an increase and for how much, had three choices in front of them. Remember, we had a 3.9 mil levy. The county could have just renewed at that 3.9 mil at those old housing values before the housing reassessment. Now that the housing reappraisal process is complete, they could have had what's called a replacement levy, which is 3.9 mils, but at the higher housing values that just took place last year. What the county decided to do was to do a 3.9 mil replacement plus an increase at those new housing values. And so the decision at council, the conversation at council, was whether or not to go with the replacement or to go with the replacement and an increase, and if so, how much? The question that voters have asked is why now? Why go through this this increase conversation now? Why not wait until 2024 when that 4.8 mil levy is up? And here's the answer. In 2024, if the county were to alter that 4.8 mil levy in any way, whether an increase or decrease, right now homeowners receive a 12.5% tax credit on that health and human services levy. And if the county were to change that levy, homeowners would lose that 12.5% tax credit, and they would pay whatever the increase that the county is proposing. So the window to change how much revenue comes in from these health and human services levy is right now, and not waiting until 2024 when that tax credit could potentially be lost.
So, but I think Will has actually, that's a great description of the mechanics
reasoning.
of the reasoning.
Yeah.
But can I also just speak to the weekly business?
Yes,
of how we
please.
spend the funds?
Right.
And so every item that generates a contract by the executive's office, by Armin Budish and his staff, as well as the Juvenile Court and our other aligned systems, goes to one of two places for approval. If it's less than $500,000, it goes to the county's Board of Control. The Board of Control meets every single Monday. It's broadcasted on the web. It's open to the public. It's in the county administration building, and a body of council members or their representatives and staff from the administration review every single contract less than $500,000. If a contract is greater than $500,000, it goes to county council. We have Councilwoman Brown in the back, and what they do is their meetings are the second and fourth Tuesday every month, and an item is introduced at council, and then it goes to committee, and it's heard at committee, and it's discussed at committee, and if approved, it goes back to council for either a second or sometimes and then a third, or sometimes just a second reading. So I just want to recognize that every single item that is related to this human service levy, regardless of when it was proposed, if it's in the new budget that Will talked about that we're operating in now, or next year's budget, they're all going to go to council. They're all going to go to Board of Control. We're going to have to justify every single use of funds. And, and I don't want to assume anything from the Board of Control or council. They ask tough questions for every single item. The public is there to view every single item.
Is the public there?
They are. I see the public I can't say it's every meeting I go to, but I see the public at the meetings.
Good.
And I think, that is critical. That level of transparency. When this government started, there was initial thought of, why don't we give the executive some authority to execute contracts up to $100,000? And that executive said no. Every single contract, every single award should be made in public. And we've done that. And I think that is something that, I don't know that every county has that. And even when we talk about purchases, a $5,000-$6,000 door or something like that for, the jail, that goes to the Board of Control agenda. We have a level of transparency that others do not. And if there are questions about how we're spending the dollars, then we're willing to look at those questions. Folks should come forward and ask.
Right.
I'm sorry, Scott. Sorry.
Scott.
Just a real quick, the Health and Human Service and Aging Committee meetings, Councilman Brown is a member of the Health and Human Service and Aging Committee, are live streamed online on YouTube. Every video is available on YouTube. I also attend all those meetings on behalf of the Center for Community Solutions, and I write a 3 or 4 paragraph blog post on every single committee. So if
We
every
find
committee
those
meeting-
at your same
at
website?
communitysolutions.com,
Yeah?
yes. So if you can't sit down and watch a 2-hour YouTube video, you can just read a 3-paragraph summary of exactly what contract got discussed and what got passed and the questions that council asked. So again, there's a level of transparency that the county is trying to do to get this information out to voters who are interested.
Okay, for an added level of transparency. So the ADAMHS Board of Cuyahoga County is quasi-independent Cuyahoga County. So we get our funding from the Health and Human Services Levy, which I also want to say there's only 2 counties in the state that do this, us and Montgomery County. So it's a unique process, and it works really well because, like we said, with the partnerships and collaboration. So the ADAMHS Board, we have an 18 board member volunteer. They're volunteers, and they represent all different aspects of the community in all different regions of Cuyahoga County. So, so 18, so 10 of them are appointed by the county executive and approved by actually Chantel Brown's committee as well. Yeah, they're approved, so 10 appointments there, and then 8 from the state of Ohio. So all of our meetings are public meetings as well. We meet, our board loves to meet, so they meet every single Wednesday. We have various committees, Community Relations Committee, Finance Committee, Program Oversight, and then we have our general meeting. So we get the approval to get the money all together from the Health and Human Service, they do that. Then our board makes the decision and makes the approval for the services that we fund.
So what does quasi-independent mean?
Because we're an independent board, so we're quasi-independent. We get our funding from the county. We also get funding from the state, and that our board is appointed by both the state and the county.
Okay.
And there's 50 boards throughout the state, 88 counties and 50 boards.
Okay, thanks. Anybody want to add any other information a voter might need? Sir, go for it, David.
Well, first, I do want to recognize for many voters, this will be the last item on the ballot. It's issue 33, and they have to think about it, please, first, right?
Yeah.
Because if there's fatigue and they don't stick around to that last item, they're not going to have an opportunity to support programs like the suicide hotline, like Life Flights, like congregate meals for seniors. I mean, we're talking about like absolutely critical safety net programs, universal pre-kindergarten, the poison control hotline. It's the last item on the ballot, but I can tell you that it's the item that is there for every single resident in Cuyahoga County.
Every single resident of the county.
That's right.
Every voter will have that on their ballot.
That's right.
It's the only one we have here in Shaker. Just tell us, does some of the funding go to Shaker Heights? Shaker Heights is not immune from the needs that you offer, that we have in the county.
I can guarantee you we serve residents from Shaker Heights at all stages of their life.
In every community, would you say? All
Every
59?
community, absolutely.
The youth center.
That's
400,000 people are benefited by this levy.
That's right.
400,000 people directly benefit.
That's right.
1/3 of the county.
Would anyone like to ask another question before we? Talk, vote, tell your friends, tell them that this will be on our website. So if they want to learn about what we've learned tonight, they can watch this video at lwvgreatercleveland.org.
Send an email out to all of our friends who are voting.
Absolutely,
There's
absolutely.
a great Facebook page on this as well. I think liking and posting anything on the social media pages, if you do social media, is very helpful. There are wonderful videos there as well. I think, again, Will, Scott, myself, we live with this. I understand we could probably get wonkish in some of the details until you put a face with this. I mean, we're talking about children who've been exposed to trauma and violence getting a better service than the state would otherwise fund. We're talking about seniors that maybe get the best meal they get every day when they go to their senior center. We can tell that story. When you look at the videos, when you see the pictures, that really translate that translates to the needs that we're responding to. So helping us promote those videos and helping us promote this, in some ways, I think it supports trust in government and in the community.
Yes, and I think one of the issues involved is concern about the county and some of the, problems it's had in the last year. But obviously, the work that you're doing is not related to those issues.
Well, in a way, I would argue that these health and human service levy dollars fill a critical need, and there are a lot of structures out there, a lot of historic decisions that still affect the county in present day. Racial disparities is real. It affects quality of life. We look at a life expectancy in different parts of the state and how much, or not in the state, I'm sorry, in the county. Oh my goodness,
Infant
sorry, it's been a long day.
mortality.
Yeah,
Infant
infant
mortality, too.
mortality, maternal mortality, life expectancy from Glenville to Lyndhurst, a 10-minute drive. It can be decades of difference in life expectancy. And, there's a lot of systemic issues that have contributed to where we are today. And these health and human service levy dollars help to at least allow us to try and close some of those disparities which are out there. And so I think that's one thing that I would encourage people to think about the impact of health and human services, not just during the election season. I would encourage you to think about racial disparities and some of the historical disparities that still exist in our community, some here in Shaker, that continue even after Election Day. And I would encourage us to think about the role that we can play in addressing these historical disparities, not just when we go into the ballot
Well, you're in
box.
charge of community solutions, Will, so.
Well, okay, so I just wrote an article for Black History Month, and I'll get a little personal here, but so my great-grandfather was a physician. He was one of a handful of black physicians in the Cleveland area. He graduated from Meharry Medical School, which was founded for black students who could not get into predominantly white medical schools. And he practiced here in Cleveland. His next-door neighbor was the late, great Judge G. Merle Capers. You may remember Judge Capers was the first African-American city councilman in the city of Cleveland. And so for Black History Month, many members of the Community Solutions staff wrote articles on black history and what it means to us in present day. And for me, I look at the racial disparities in voting, in health outcomes, in education, in criminal justice, some of the systemic barriers and the physical barriers that still exist. And the question that I asked myself in that column that I encourage all of us to think about is, what is going to be our answer to these issues? What's our legacy going to be? And the continuum of history, at every place where there's been systemic issues that have taken place, there's been a response, whether it's an activism response, an advocacy response, a civic or a public official response. But people have rallied to try and help those who are afflicted. And where we are right now in this time in history, I believe there's a lot of need that's out there. Just turn on the news. And things like this, voting on an issue like this, can help chip away at some of those disparities that still exist out there. And so so I challenge all of us as advocates to not just think about health and human services in an issue of issue 33, but even after Election Day as well.
After this passes.
That's right. Stay involved, not just beforehand.
I would say that I don't take any vote for granted. Our community should not take this next election for granted. The last time we asked for an increase in 2013, it was approved 53% to 47%.
Oh.
And that is close. That is very close. And I think, if we can just think for a second what our community would do without the hundreds of millions of dollars over a biennial budget this generates, that is at risk. Absolutely. That is at play, and I don't take it for granted. I do want to plug while we're talking and we're still on camera, the other opportunity that is upon us and requires the public attention, and I know has been supported by the League of Owners, is the census. That's the other thing that's out there. I would ask, when we talk about the levy, frankly, the census is the second biggest because we're here talking about the levy issue.
We've been recruiting volunteers for the census for a while
So-
now.
Yeah, so the county, Cuyahoga Counts coordinator that is leading the census work is in the Department of Health and Human Services, is supported by the Department of Health and Human Services. And it's because we recognize there are people in our community that are marginalized. They are not engaged. Their voice is not being heard. And our programs are serving them. And we call on our programs, connect them to their right to vote, connect them to their right to be counted. Every single director in our department is charged. What is your plan to help your clients vote? What is your plan to help them and ensure that they're counted? And even though that's not their core responsibility,
They're doing that.
it's our expectation.
Yeah.
Tri-chair of the hard to count committee. It's been a long day too, right? For people living with mental illness and addiction as well. And a lot of times people are afraid to be counted, but that's why we need to get the word out. Don't be afraid to count it because federal funding depends on it.
Absolutely. Could I just ask real quickly, backtracking a little, how do the local communities, do they deal with your funding? Do things go through like the city of Cleveland or the city of Shaker Heights, or is this totally county?
So these are
Administrative.
county funds. They're administered by Cuyahoga County. We have many partnerships with municipalities. Senior Services is probably the greatest example in that we have our community social service program where senior service agencies, whether they're municipal focused or they're a nonprofit in a community, get funding from us to provide safety net services. The same thing could be said for youth services. Our Division
So
of
you're
Children and Family
talking about
Services
the-
funds the City of Lakewood and others to have youth programming. Our Office of Early Childhood works with many public school systems to ensure that the children in those communities can that can go to high-quality pre-kindergarten. And our Family and Children First Council helps to provide after-school programming. So I think the extent to which we're braided in this community is pretty exceptional.
How about pre-K? Is it reaching a lot of children now?
It is. There could be more funding, and there could be more services. We
Okay.
have to recognize that.
know that's been
But we've
pushed
stayed
for a
at this
while.
level, and part of the ways that we're going to spend the increased funds, if supported by the voters, is to sustain. We got some local investments, some business corporate investment in the universal pre-kindergarten program. That's set to expire. The additional money that will be used, a portion of that will backfill the expiring corporate investment.
all right.
So we want to keep the level that we have.
We have mental health prevention in all of the school systems. So the mental health and ADAMHS board.
Sure, go ahead.
The money, the funds that were utilized, increased our universal pre-K from 2,000 students to 4,000 students.
So, thank you. Thanks a lot.
Making sure we got that on camera. So the
go
universal
ahead.
pre-kindergarten, Councilman Chantel Brown was remarking, universal pre-kindergarten increased the number of children from 2,000 to 4,000, receiving high-quality universal pre-kindergarten. By the way, pre-kindergarten is great, and it should be universal, but we have to focus on high quality because our children deserve the right preparation for when they get to school.
Absolutely. Anyone else want to ask a question from the audience?
Can you tell us that link again, where somebody can go and look and see about the levy?
Oh,
Let's see,
Your-
about the
About the levy.
oh, sure. So you can go a couple places. The campaign on Facebook, you type in issue 33, and the Health and Human Service Levy campaign will
so is
come
that
up.
your Facebook page? Is that the Facebook page?
It's the campaigns page, correct. Yep.
Okay.
On communitysolutions.com, you'll find three things that I think would be helpful. One is a breakdown. It's an actual paper on the Health and Human Service levies, both of them, where the money goes. There also is the levy schedule. of when each when each county levy expires, when it's up for renewal, how much money comes in, where the money goes, how much it costs individual homeowners. So just go to communitysolutions.com, type in levy schedule, and it'll come up. And then we also did a blog post actually right after county council decided with the county executive to propose this increase. We wrote a very quick write-up that explains the increase and how much is going to come in if the levy passes, and how much it will cost homeowners. So if you're looking for just the basics, you can see that on communitysolutions.com. My email address is up here. If you'd like to just email me and say, hey, Will, can you send me what you talked about? I will.
I'm thinking about what's the best thing for me to,
Sorry?
what's the best thing for me to put in an email that I send out to 100 people?
Well, I would say the campaign, I can't speak for the campaign, but the campaign's put together some really handy materials.
Yeah, so so I agree. The campaign is a great source. I think we have it in the papers in the back. I will point it out to you. That's it. Yeah. So I think the fact sheets are well written, and I do believe that we owe the public a higher level of detail, and I think these fact sheets capture a lot of the detail. But I'd be happy to talk to you after also if you need additional information. I think there's.
Michael? Online?
We'll find it. I will find the online, the web address.
Okay, Michael?
Metro Health. We are rebuilding the main campus. Is that impacted by this levy? And where is that? Are they breaking ground and?
The elevator shaft is, I was just over there today for a meeting, and the elevator shaft is over for the new building. So yes, they are moving ahead, but they are funding that, not the building, not through the Health and Human Service levy. They have other funding for that.
Yeah, the human service levy cannot be used for capital purposes. So we don't build buildings with the human service levy. And so the answer to the question is, is the levy being used for the refresh of their facility? The answer is no.
Just to put a number on that, the Health and Service levy dollars are 3.3% of Metro Health's total budget. So it's a small amount compared to all the things they're doing over there.
And it's still being used for indigent care despite the fact that there's Medicaid expansion and the Affordable Care Act.
Absolutely. Metro Health has done a great job of expanding their services into the community around it, and Councilwoman Jasmine Santana will tell you how important it is, for residents of her ward and of that portion of Cleveland to have a great relationship with Metro Health, and it's due in large part to those health and services levy dollars.
Just a reminder that when you look at Will's list of levies, the county library levy does not affect Shaker Heights City School District. We have our own library system. So I don't want people to get confused if you see that levy on there. We have our own levy.
I did not get into that
You
here.
mentioned the library, that's all. You look at your list of tax, I have seen that list, and you think, wow, yeah, there's quite a bit, quite a few. They don't
and
all
there's
hit
some
the
things
ballot
that
at
we
the same
don't
time.
talk about. So just in terms of things that the taxpayers support. So we have a 1.0% sales tax that goes towards RTA. That's the highest in the state. And so, we make decisions as taxpayers, and as a county, we're very, very generous. But we also need to figure out where these dollars are going, and just make sure that people understand, not just how much things are going to cost them, which, I understand there's been a lot of scrutiny around that lately.
Right.
But just as important, where those dollars
Where
are
the
going.
dollars go.
Absolutely.
Yeah. Well, thank you, everyone. Go out, talk to your friends and neighbors. Thanks a lot.
Thank you, Marcia, and thank you very much, League of Women Voters.